Hello and welcome. Let's talk about dumping syndrome, or also known as post-shiver syndrome. Early dumping. Early dumping consists of abdominal and vasomotor symptoms following gastrectomy or vagotomy and drainage. It also affects a small percentage of patients following highly selective vagotomy because of the loss of the receptive relaxation of the stomach. The incidence is 5 to 10%, and the vasomotor symptoms appear immediately after food, lasts for 30 to 40 minutes, and is aggravated by bulky food. It is relieved by lying down, and it is aggravated by more food. The clinical features: epigastric fullness, sweating, lightheadedness, tachycardia, abdominal colic, sometimes diarrhea, hypotension, and features of hypovolemia. Treatment: the principal treatment is dietary manipulation. The small and dry meals are best, and avoiding fruits with high carbohydrate content. Somatostatin analog octreotide may be given before meals, and it has been shown to be useful. Let's talk about late dumping. This is reactive hypoglycemia. The carbohydrate load in the small bowel causes a rise in the plasma glucose level, which in turn causes insulin levels to rise, causing a secondary hypoglycemia. It is of less severe type, and the incidence is 5%. It usually occurs 2 hours after meal, and it is relieved by glucose inactivated by exercise. Clinical features: tremor, fainting, nausea, and features of hypoglycemia. Treatment: the symptoms are less severe and so treated conservatively by giving glucose and food. Now, differences between early and late dumping. In early dumping, the incidence is 5 to 10%, while in late dumping, it is about 5%. The relation to meals is almost immediate in early dumping, while in late it is second hour after meal. The duration of attack is 30 to 40 minutes in both early and late dumping. And early dumping is relieved by lying down, and late dumping is relieved by food. While early dumping is aggravated by more food, while it is aggravated by exercise in case of late dumping. The precipitating factor in early dumping is food, especially carbohydrate rich and wet, and it is same in case of late dumping. Now in early dumping, the major symptoms are epigastric fullness, sweating, lightheadedness, tachycardia, colic, and sometimes diarrhea. But in case of late dumping, the major symptoms are tremor, faintness, and prostration. End of the topic.